So there are a number of highlights of ASH this year. One of the highlights actually is a slightly unusual one for me at least, and that is elderly diffuse large B. So one of the really good trials that was presented was a negative study, so it was in over 80-year-olds. It was done by the LISA group, the French group, and they compared R-miniCHOP, so reduced doses of R-CHOP, with R-miniCHOP plus lenalidomide in the over 80 population. The reason why this is one of my highlights is that this is the first randomized study that I'm aware of in that age group, and it's a really good proof of principle that we can do it. So one nation, essentially France, delivered a randomized trial of 250 patients over 80. That's a phenomenal achievement. And they also showed quite convincingly, as you might expect, that activities of daily living, so in other words, if you're frail, patients do less well with their R-miniCHOP. And also there was a nutritional assessment they also used, which again showed that if there are impairments there, patients do less well with their treatment. So although it was a negative study, it hasn't pushed the therapeutics anywhere further forward. It's really set a benchmark, I think, for the quality of trials that we can and should be doing in that age group. And the other elderly study, which I thought was really good, was done by the Italians, where they used prospective data, again in an older patient group, where they looked at frailty scores. They also looked at the International Prognostic Index and other factors and identified anemia as a key factor. And they've developed an Elderly Prognostic Index, or EPI, which both in the training and validation sets discriminated very well between low, medium and high risk patients. And the reason why this is important is different study groups have used different sort of scores to look at elderly, frail indices, etc. And we really do need something that's validated to provide some uniformity in the field. And I very much hope, and I'm quite optimistic, that this will provide, again, a useful tool that a number of study groups can use in this area.